glad to be presenting this program, the sector update. The Honourable John Carey, Minister for Housing and Homelessness and Lands, will be joining us around 2 to present an update on actions being undertaken by the WA Government to end homelessness through the Office of Homelessness and in partnership with service providers. And there'll be a Q&A session after that. The Minister was very generous to launch our Homelessness Week this week via video. He was up in the Kimberley, which I can tell you, having just returned from East Arnhem, that it's much nicer up there than here. So I have no doubts why he was there. But we were very delighted that he did that video. But first of all, we're going to hear from the sector. It's going to be a fast-paced session where each speaker will have 10 minutes to speak about their project, covering what is the project, where is it headed, and what's the call out for the audience. And the agencies will include Supporting Communities Forum Homelessness Strategy Implementation Group, the Youth Affairs Council of WA, the WA Association for Mental Health, and Noongar Maya Maya. And we'll also hear from the 100 Families and Just Homes Margaret River, Living My Best Life, and Shelter WA. And at the end of that, we'll hear from the Minister. So what I'm going to do is I'm going to invite up the speakers in our first session onto the stage. If they can join me when I call them out. You'll do your presentation and then stay on stage for questions afterwards. So I'm going to invite up Supporting Communities Forum Homelessness Strategy Implementation Group Co-Chair, Deborah Zanella. I do a bio, but the title is enough. I'm also inviting up the WA Association for Mental Health Project Lead, Colin Penter, who is joining us via Zoom, and Aboriginal Homelessness Program Lead and Director of Noongar Maya Maya, Tina Pickett. And we've got a switch, which Sandy McKiernan is currently stuck on the tarmac while they're running an extension cord out to the Aero Bridge, which happened to me last night as well, not joking. So we're going to bring up Alex Hughes, who's the project manager of Just Home and the 100 Families project as well, to this session. And hopefully Sandy will join us in time to make the second component. Okay, so thank you very much. And I'm going to invite up Deborah Zanella.
Can I also start by saying Nalakarach Nunga Mort Kain Kajak Nijabuja. I'm really apologising for all those of you who've been here today and have seen me 3 times in the last 2 days. That's a dreadful thing for anyone to have to endure. I'm here today as co-chair of Supporting Communities Forum, and I was just saying to Jackie Herring from the department, I pretty much guess no one even knows what SCF is anymore and where it started. But I also want to acknowledge my co-chair is Tina with Mike Rowe. So there's 3 of us that chair the implementation of the 10-year strategy working group. But the Supporting Communities Forum, this is its 3rd iteration. First iteration was under the Liberal government, sorry everyone, which was called the Partnership Forum. And it was a way of dialoguing between the not-for-profit sector and government and developing that relationship. When Labor came to power, when Labor came into government, sorry about that Freudian slip, they reconstituted that to be called the Supporting Communities Forum. And it was that first forum that had a working group that was really, I think, one of the best working groups that I've been on, that had the sector and departmental representation looking, and we worked together to develop the 10-year strategy based on the work that the WA Alliance had done. And I think for those of us who were around in that day, I think today, still to this day, people think it's still a pretty good strategy. And I think that's testament to the level of collaboration, you know, and toing and froing that occurred in that first iteration of Supporting Communities Forum. The minister then, which was Minister McGurk, then asked for that continuing working group to have oversight over the implementation of the strategy, which I can see some departmental people here today who prepared my speaking notes, which I'm internally grateful for. Otherwise, I would have had nothing to say in terms of my preparation. But I think implementation is a far harder gig than the development of the strategy, and that has borne out time and time again. So I'm just going to briefly touch on some of the key achievements that belong not really just to the Supporting Communities Forum, but to the broader sector collaboration that's occurred. But I can't underestimate the difficulty of implementation and how hard system reform is, and the challenges that we face doing it. So let me just briefly mention a couple of things. I think one of the key things in the implementation in the working group that we've tried to keep really true to, and it's still really early days, and we have a new minister, so things are prone to change again, but it has been guided by the housing first philosophy and the no wrong door approach. The department actually, the team in the department did a phenomenal job of looking at the whole of the strategy and then doing kind of an analysis and breaking it down into 2 action plans and then a whole set of actions. And the first action plan, which is 20 to 25, has about 58 actions that are aligned to the strategy. So it's a really good, solid piece of work that's been done on behalf of the working group to try and guide the implementation. One of the things that we notice a lot, the focus for the first 5 years was that there was to be a focus on rough sleeping. And it wasn't to say that, and that's rough sleeping across the board in terms of couch surfing and also youth. And that's not to say, and it isn't to say, that the strategy doesn't address other drivers, and nor does it not address prevention. But it recognised, and if you were here this morning at the health session, the vulnerability and the mortality rates of people who are rough sleeping press us to address that issue. Ideally, we were to have solved rough sleeping by 2025, really. That's unlikely to happen. But having said that, the plans and the action plan really tries to attend to some of those things as well. The other key thing that's very, very evident in the implementation working group, and with Tina's representation on that, has that Aboriginal wellbeing and the outcomes for Aboriginal people in the space has been paramount. So the 2 things of a housing first approach as a philosophy that underpins the strategy, as well as Aboriginal wellbeing, are 2 key drivers that the Supporting Communities Forum are really driving. Some key highlights: it's a bit more governance rigor that's been put through by having the group, by having the ministerial portfolio now that is housing and homelessness. There's been work done over the last 12 months on place-based homelessness response systems. The Department of Communities has commenced a regional and systems-based commissioning approach as well. There's been a lot of work done in embedding housing first principles. And in particular, Tina's team, under the direction of Sandra Harbin, did a lot of work around looking at translating the international recognised housing first principles and making them Noongar specific housing principles, which is a core piece of work. The Youth Homelessness Roundtable, which is looking at the development of housing first for youth, which is again another first. In terms of additional supported low barrier accommodation, obviously, Burulu, Biddy, Maya, and Court Budja have been particularly important as low barrier and addressing the issue for Aboriginal people. There's been more short stay accommodation that has been established with 3 new facilities in Geraldton, Wilby, Kununurra and in Perth, which adds to Kalgoorlie, Boulder, Derby and Broome as well. The increase in, I won't go too much into this one given the recent media hype, but supply of supported accommodation. Obviously, the great hope of having 2 common grounds, which have been slightly delayed, but that supported accommodation for people who will always require a level of ongoing support and assistance are critically needed. And I think the Minister's very clear that all of the accommodation needs are today, not tomorrow, and I know is committed to working to try and make as much of that as happen. We have seen a lot of work done in an increased system of coordination. The Housing First Homelessness Initiative, which provides long-term accommodation and wraparound support. Obviously, it goes without saying, one of the challenges for the sector and for the department has been to staying true to housing first principles, which is long-term permanent housing and support in the absence of adequate housing supply. And that is a challenge for the department. It is a challenge for us, and it's mostly a challenge for people who are homeless. But we have seen coordinated housing first support services in 2 or 3 regional areas: Bunbury, Geraldton, Rockingham, Mandurah and Perth. And as of the 30th of June, 170 people have been case managed in that particular space, and 51 of those people, 56 people into long-term housing. I just wanted to quickly have a moment. The other key area that sits alongside that coordination, of course, is the work that's been done by the Zero Project. Can you? Thank you. And again, for those who aren't aware, one of the commitments from the sector when we set up the Zero Project, which was its forerunner was 50 Lives, 50 Homes, is that we would try to make the data available and transparent to the general community. So for those of you who haven't seen the Zero Project website, it gives us a key indication at points in time about where we're sitting in terms of homelessness, in terms of rough sleeping in particular. And so this is just a snapshot from Perth. We are doing work with the department currently about bringing data sources together to get one source of truth. And I would hope in the next couple of months, everyone will be very happy, delighted, and also confirmed about accuracy around data. But I think whichever source of data you look at, we know that the inflow, that one of the key factors in ending homelessness is we need to understand the drivers that cause people to come into homelessness, and we need to be able to monitor the rate of inflow versus the rate of housing placement. And that tells us where we're sitting as a community in terms of what we call functional zero, which effectively means that there are less people coming in than there are being placed, which is not the state that we're currently in. So that, if you haven't seen that site, I would really encourage you to have a look. There's been more work done on that particular website that actually you can break down and look at the data in particular. And for those of you here this morning, sorry? Thank you. If you were here this morning, you will, it's probably on a couple of slides later, but in particular, the data around health, which is not that one, shows that of the 1,300 individuals that are recorded through the by name list, over 450 of those have trimorbidities. They have more than 3 pressing significant health concerns. So it goes testament to that issue of the vulnerability of that particular group of people. The last couple of things I would probably say is in terms of coordination, we also have emerged after the Fremantle incident was HEART, which is a coordinated service homelessness engagement assessment response team. In Perth, we've had the Safe Perth City. We've got the development of the online homelessness portal as well. Youth accommodation and support services in WA are currently being resourced with additional drug and alcohol workers. And obviously the big issue around housing supply, is that we continue to advocate in that space, and the Minister continues to look for properties. So I think that whilst, you know, standing here, I'd love to be able to say there was much more that we've achieved. I think we've started lots of initiatives. The working group is attempting to bring the whole of the strategy into sizable pieces that can make sense to people, and also for the sector and for the department and for people with lived experience to see that there are some wins along the way in terms of implementing the strategy. Thank you.
I think I'm shorter than you. Kaya Wanju, Nunga Buja, welcome everyone to our beautiful city, Bulu. My name's Tina Pickett and I'm the Managing Director of Nunga Maya Maya. Nunga Maya Maya is a community housing organisation that have been around for 21 years, pretty much under the radar. Recently, in the last 4 years, we've kind of ventured out and developed a lot of partnerships. So I just sort of just want to give you a bit of summary of some of the things that I'd like to bring up and let you all know about Nunga Maya Maya. So I am going to read because I'm not really good at just letting it all out. But the WA homeless strategy recognised that Main Street methods aren't effective long-term solutions. And self-determination and self-management are just as important now as they were when Australia acknowledged their importance back in the 70s. But what's been missing over that 50 years is action, resourcing and empowering communities to take the lead. The WA Homeless Strategy has a key focus area of improving Aboriginal wellbeing by building cultural responsitivity in the wider sector and by empowering Aboriginal organisations to take the lead. Noongar Mai Mai is helping to deliver on this focus area, both by bringing self-determination and self-management into action, and by helping other orgs and workers in the housing and support systems to operate from a third space position of understanding and respect. Maya Mort is all about Maya, home, Mort, family. Is all about building that cultural responsivity, not just within mainstream orgs, but for ourselves and other Aboriginal orgs, as well as we continually learn and do better. Aboriginal people are vulnerable times in their lives seeking support, can end up worst case, shamed and coerced into cultural compromise. And it's not always willful coercion. Because even with the best intentions, if you're working without understanding certain important aspects about culture, it's hard to be effective in your work. And Aboriginal people often report being exhausted, having to explain cultural factors to support workers again and again. And then because of turnover and siloing, having to start the whole process again. Especially when Noongar Mai Mai is working with Noongar people, these factors are often naturally obvious for us as an Aboriginal standpoint because we share that culture. And I'd just like to add that 98% of my staff are all Indigenous and they're all Noongars. So we have 2 non-Indigenous and they're pretty much Noongars now because we've educated them. So yeah, we're often hearing from the people we support what a relief it is to work with someone who gets it, who they feel safe opening up to and who understand and respects our values. There's a lot of knowledge that can be conveyed to non-Aboriginal organisations and workers that are committed to doing the work and coming with us along on this journey. And we've done some amazing work collaborating with organisations like RUA to work with our mob. We know other organisations in this space are full of people working tirelessly and who are time-starved, but with almost half of Perth rough sleepers being Aboriginal, if we're going to end homelessness in WA, we can't afford not to all walk together bit by bit towards a better future. With that in mind, Deb touched on the Noongar Housing First principles, which we did gain so John Berger was one of the main instigators, and Leah from Rua at that time. She's gone now. Yeah. Yes, housing choices. So basically we got some funding off lotteries who have been absolutely very supportive to Noongar Mai Mai, and Sandra Harpen, if you don't know her, she's our cultural advisor and an elder in our community. And the full report of the principles available on our website, and we're continuing to seek funding from Lotteries West. Is there anyone from Lotteries West here? To yarn more with our homeless mob, our tenants and our caseworkers, to extend what we've learned into actionable service advice. It's important that Maya Mort doesn't start and end with a report. Systems change is a complex and ongoing process. So the Mudich Maya program, which we've been funded by the state government to provide WA's first Aboriginal Housing First support service in partnership with Wanjaning, is part of the Housing First rollout, and we've been delivering that for a year now and currently supporting 50 people. 19 we have housed, and we've got many more onto Centrelink and got them ID documents and onto the priority waiting list. Now this has been really hard work, and we've found that you have to casework each individual person in their homes, whether it's weekly, daily. You've got to constantly be on their case. The rental crisis has delayed the Housing First rollout, meaning we've had to be creative in order to secure housing for our mob. But thanks to a recent generous philanthropic donation, we're planning to roll out our own rental subsidy program to bridge the gap so our mob don't have to wait for the first housing rollout to catch up. After all, the housing element is key to Housing First, and support is a lot more effective when you're safely off the streets in a position to heal and thrive. Very proud of what Muditch Maya has achieved. We've worked with mob who've been on the streets for nearly a decade, who've had no source of income, haven't been able to get on the wait list and often had no caseworker. The work we do with Muditch Maya is grounded in the Noongar Housing First principles. And in turn, we take the stories we learn from our caseworkers of how they've gone on to change lives, and we feed that into our service model. Bullamort is a tenancy program that we have also within Noongar Maya that's been generously supported from the Sisters of St. John of God. And we now employ 2 tenancy support workers, and we're having 1 more, who provide culturally secure psychosocial support to a total of 28 Aboriginal households. So we have over 100 properties. And not all of the tenants want to sign up on it because they're managing fine, but there's those that really need that support, and 28, and it just gives us the right to go into their property without all the, the registration, the agreements. This support is tailored to the needs of the tenant. They can look like anything from accompanying them to doctor's appointments to helping out with home and garden maintenance, helping them through a crisis, and even supporting family reunifications. It can be Christmas present for kids or just a sympathetic person to yarn with. So in conclusion, I'm really, really proud of all the partnerships that we've built. Shelter WA have been absolutely amazing. Michelle, really going to miss you when you go. Rua, everyone, thank you very much for supporting Noongar Maya, and hopefully we can get some more funding and more stock and house our people. Thank you.
Thanks, Tina, and thanks, Deb. We're going to go to Colin, I think, on Zoom. Royston, can you press a magic button?
Good afternoon, everyone. I hope you can hear me. My apologies for not being there in person. And I would also like to just pay my respect to Aboriginal elders past, present and emerging, and acknowledge that I'm also on Whadjuk Noongar land today. I'd also like to pay my respect and acknowledge anyone in the room with lived experience of either mental health issues, homelessness or alcohol and drug issues. In particular, I see Jonathan Shapira there, who's been a great advocate for people with mental health issues and homelessness, and I must pay my appreciation for the education I've received from working with Jonathan. For those of you who don't know WHAM, we're the peak body for the non-government mental health sector. WHAM is not a service provider, but it does deliver a range of supports and programs to the non-government mental health sector and to other agencies and sectors that work with people with mental health issues. Our work aims to, strengthen the non-government sector, impact on the policy and funding around mental health issues, particularly at state government, but also at Commonwealth level. And also to identify ways that we can build and create and support a better mental health system that meets people's needs. WHAM's been active in a range of areas around mental health housing, particularly in the areas of mental health supported accommodation that are primarily funded by the Mental Health Commission, and also some funding that's provided to the mental health sector, particularly agencies working in the homelessness space through the Department of Communities. And we work to really try and strengthen and increase the investment in mental health supported accommodation, particularly through the Mental Health Commission, with varying degrees of success. but it's an ongoing project that we have. Today, I want to talk about just one particular part of the work that WHAM's been doing recently on a sector that is often overlooked in terms of both the impact it has upon people's mental health and the contribution it does make in terms of contributing or as a pathway to homelessness, but also the opportunities for improving that sector's capacity to respond to people with mental health issues. And that's the private rental sector. You may not be aware that most people with lived experience of mental health conditions rent in the private rental sector. Although you will also be aware that that sector is such that many of those people experience an exacerbation of mental ill health as a result of the insecure and unaffordable nature of private rental. They also face, as many of us do, significant challenges in securing and retaining private rental, particularly in the current environment. We also know that the private rental sector, and many of you here will, from your own experience or from the people you work with, will know that private rental is often a pathway into homelessness. And we also know in the mental health sector that there are declining stocks of public and community housing and supported mental health housing relative to demand for those services. Mental health accommodation is highly rationed relative to demand, and there's significant blockages in the system because of the lack of stock. So I guess what that means is that programs and services that support people with mental health conditions to access and sustain private rental are a vital element of the suite of mental health supported accommodation programs. It's not the only one, and there are significant challenges in that, but it is a tenure that really does need greater attention in terms of its impact and its capacity in relation to housing people with mental health issues. Western Australia lacks any specialist private rental mental health housing recovery support program for people with mental health conditions. There are some private rental tenancy support programs funded through Commonwealth money and the Department for Communities, and some mental health service providers deliver those programs, and those programs include often people with mental health issues. But there is no specialist private rental mental health support service funded through the Mental Health Commission here in WA. There is a very effective private rental mental health support program delivered by Wellways in Victoria, a program called Doorway, which has been operating in Victoria for close to a decade and has gone through both a pilot phase and then an implementation phase, and has been the subject of significant evaluation, which demonstrated the effectiveness of the program, and that the program, a private rental mental health support program, can have a significant impact in terms of delivering significant benefits for participants. WHAM's been working with Wellways Victoria for some time now, and also with some other stakeholders and the Mental Health Commission, with a long-term vision to try and establish a pilot of the Doorway program here in Western Australia. A key part of the Doorway program is the involvement of the non-government sector, the active involvement of the public mental health teams, partnerships with the private rental sector, particularly real estate agents and landlords, and also a partnership with employment providers in order to try to secure employment opportunities for the participants. The program does include significant rental subsidies, significant housing and recovery support, and there are also incentives for landlords within the program. The role of the public mental health teams is critical in the Doorway program. The non-government mental health recovery workers are co-located within public mental health teams. So there's an integrated response involving public mental health services and the non-government sector in terms of both securing and then securing a private rental tenure and supporting people in that tenure. As I mentioned, one of the priorities for WAM at the moment is working with a number of stakeholders, including some public mental health services and the Mental Health Commission, to try to establish a pilot of the Doorway program in WA. And Wellways in Victoria have been very supportive of that initiative. So we're hoping that in a certain time frame that we may be in a position to roll out a pilot of the Doorway program with some non-government providers, with a public mental health service, and with the support of real estate agents and the real estate sector. So that's, I guess, the part of that program that's important is trying to acknowledge the role that the private rental sector can and should play, and how we can strengthen that sector despite the very difficult circumstances that we currently face in that sector, to really support better people with mental health issues, as that is the tenure where the majority of those people currently live. The other thing I just mentioned briefly on that is some of you will be aware of the Make Renting Fair campaign, which has been initiated by a consortia of non-government agencies and people with lived experience who are renters. That's a continuation of a campaign that's about trying to reform the Residential Tenancy Act here in WA. And I would encourage those of you who are interested in that issue that that campaign is being coordinated through Shelter WA, and there may well be Chantel and other people there from Shelter who, if you're interested in that campaign, I would encourage you to make contact with her and maybe contribute to the campaign. The other thing I would highlight for you is that WAM is collaborating with the End Homelessness Alliance next week for the August Pulse session. Thanks to John Berger for his support. That session will include a presentation by people from Doorway in Victoria about the Doorway program. And it will also include presentations by Donna Turner from Shelter WA on the project that she's running on tenancy support for people with disabilities, including people with psychosocial disabilities. And it'll also include Daisy Ashdown from Red Cross, who'll talk a little bit about the private rental tenancy support services that operate here in WA and the contribution they make to support people with mental health issues. So I'll finish up there, and just to finalise, just to raise the point that I think we're keen to try and highlight the role of the private rental sector and how we can strengthen that sector, as that is where the majority of people with mental health issues live. That's not to say the other types of mental health supported accommodation aren't as important, and WAM will continue to support and advocate for much greater investment by particularly the state government in and through the Mental Health Commission for greater investment in the full spectrum of mental health supported accommodation. And thank you very much for the opportunity. And can I just say thanks to everybody in the room and on Zoom for the fantastic work you do with people with mental health issues.
Thanks, Colin. We're going to switch now to Alex, our final speaker, and then some questions.
Thanks. Thanks, everybody. And thank you for the opportunity to come and talk today. Thanks to everyone in the room and to those who are joining us online. My name is Alex Hughes. I've got two hats, so I'm going to be talking about the two different jobs I have. One, I've had 4 years as the project manager of 100 Families WA. Royston, do I use this clicker? This one? The other one I've had for 4 weeks, and that's the program manager for an organisation in Margaret River called Just Home Margaret River. So I'm going to give you an update on both, and hopefully I can interlink them because I think they do. For those who don't know about 100 Families WA, so we started 4 years ago. It's a collaboration of 10 organisations who understood that what we were doing wasn't working for everybody. So families who are experiencing disadvantage are getting stuck in our system. So the goal of the project was to, through research, understand what they were going through, how we can change, and what we can do differently to help improve their system. So we can change the system for their benefit. And so that was done through data collection, 400 families over a longitudinal survey, and 100 families, meeting them every 2 weeks for a whole year to really understand their journey, their qualitative experience. We have lots and lots of findings that tells to the drivers of how people end up in disadvantage. Obviously, the theme of this year's Homelessness Week is housing, homelessness and health. The intersectionality of those issues is very hard to tease out. I mean, we have lots of resources like this to show the experiences of how childhood through to acute accidents or events can lead to homelessness, and then through a series of perhaps not having access to support leads to entrenchment. The same with Brianna's story, how adverse childhood experiences combined with trauma, combined with stress, can lead to things like strikes on Homes West housing, and then the entrenchment grows. So where to now for 100 families? So a few things. In some ways, we're winding down, so the project is coming to an end, and in other ways, we're starting. There's some spin-off projects that are beginning. So some of the partners you'd have seen in the logos on the first slide are creating new projects of their own to try and understand and to live and walk the walk, essentially, co-designing with families to change services. So that's happening now. We're also starting soon an Aboriginal Voice project. A third of the families, so a third of the 400 families are Aboriginal. And so it's important to understand their lived experience and interpret their findings through an Aboriginal lens. So Glenda Kickett's going to be leading on that soon. The final thing that I want to do, because I'll be leaving this role next month, is we want to centralize all this learning. As Tina said, I didn't want to end a report. We have lots of reports, we have lots of snapshots, and they're helpful. But there's other things that need to be done to support the sector to make those necessary changes that families say that they want. So centralizing those learnings and those resources in a centralized hub, which is the website, is what we're going to be doing. And that's going to go live next month. So these are the kind of things that you're going to see. I don't know if you've seen the Welcome to Our World platform in the top left. That was launched a few months ago. But it's an interactive portal that you can follow people's journeys. They're spoken by people with lived experience, and we interweave stats findings on top of those. But it's them telling their stories about what they're going through. So it can be used for PD, it can be used for inductions of staff, community awareness, strategy development, however you want to. At the bottom, we've been producing some advocacy videos. So we've released 3, we've got 2 more to go. And on the right, this is what's happening next month. We're releasing some e-learnings. So those are the overarching findings from the project, spoken by people with lived experience. There'll be some self-administered training that you can use and deliver yourselves in your organizations, whether it be with a group or just one-on-one yourself. And rather than me tell you more about that, I'm going to let them tell you. There's a 1-minute video. This is still in draft, so it's not released until next month. But you guys get the first look. So let's see if this works. This is presented by Damon and Charlie. So we have a member, so we have 8 members in the Lived Experience Advocacy Group, a group that's been running for 8 years. They're hugely passionate, and yeah, here they are.
Hi, my name's Charlie.
And my name is Damien, and this video is an introduction to the bite-sized presentation series that covers the key learnings from the 100 Families WA project.
For those that don't know, 100 Families WA is a collaboration of 10 organisations working alongside families living in entrenched disadvantage to better understand what works, what doesn't, and what could be done differently.
5 videos were presented by members of the 100 Families Lived Experience Advocacy Group. They may have experienced some of the following: homelessness, mental health, discrimination, family domestic violence, poor health, or stigma.
There are 5 major learning themes that organisations need to pay attention to.
Livable income.
Hear my voice.
Better access.
Investing in relationships and quality support.
Challenge stigma and discrimination.
Each video has a call to action.
So please pay attention to the questions at the end of each video.
There we go. So that's the introduction video. It's just a minute long, but there's 5 other videos that will be going with that e-learning software, e-learning resource. And I encourage you to really make use of it. We've spent a lot of time developing it. It goes very evidence-based. It's spoken by people with lived experience. They've developed the whole package, and yeah, it will be on that website next month. I may have pressed the wrong button, Royston. I don't know how I get back to the next slide. Oh, look, we did it. Technology. My other hat is the program manager for Just Home Margaret River. So that's a grassroots movement for housing justice in the Augusta Margaret River region. Now, as we know, these solutions are always needing to be put into context of people and place. And Margaret River is a great example of that, because what works there isn't going to work in the north, isn't necessarily going to work in the city. We know in Margaret River there's 27 to 30% of the homes are unoccupied, essentially second homes or holiday homes, whilst there's a huge housing crisis in terms of rental stress and homelessness that people often don't know about. It's severely unaffordable. So we're trying to come up with solutions, and Just Home is the epitome. It encapsulates all those learnings that we just put out just a second ago. Meaningful partnerships, though, is one of the goals that we want to pursue, and it's one of the learnings of 100 Families. Anecdotally, this is not 100 Families learning, this is just something I think is true. The larger the organisation, the more resources and capacity they have, but the more challenges they have to connect back to the person on the ground. And that's no dig at big organisations, just the natural challenge that comes with bureaucracy. Whereas grassroots organisations are automatically connected because often they're run by communities, so they're already ingrained. Their challenge is meaningful partnerships with the players who are able to resource them because they're under-resourced. So these are the goals, I guess, for Just Home, and something I'll be keenly pushing in the next few months. I'll leave it there. I don't know why this slide's a bit squiff, but you get the idea. A call to action, I guess, for you guys is keep checking the 100 Families website. Next month, it will go live in terms of the changes. All those resources will be available. Please use them. If you have an organisation that is lucky enough to have a learning and development area, send them there. Strategic policy endeavours, please use them. And if you're interested in linking with me in Just Home to pursue how we can change the lives of people in that area, please also connect. Thanks.
Okay, thanks so much. So thank you to Deb, Tina, Alex and Colin online. We're going to open up the floor to questions. So if you've got a question, raise it. Look, there we go. That's how it works. You raise your hand and a microphone runs to you.
Question really for Colin and Deb, if you may. In regards to the actual COVID experience that's going on, the rental problem obviously has become enormous, and what we're actually seeing is a huge increase as far as the number of homeless people are concerned. In the data that you collected, Deb, this obviously was not expected going into COVID. Is there preparation in regards to data collection? And for Colin, it is, I was going to say mental health challenge in regards to the sudden loss of housing, how is that seen as seriously affecting a lot of people more than understood and really prevailed with?
Okay, we might go to Deb first.
So in terms of the data that's been impacted in terms by the decrease in rental availability, we certainly are, there are different sources that we capture in terms of people that are exiting homelessness, people that are coming into homelessness. Actually, Nat, you might have more information about information that we're catching in the rental private market in terms of, did you want to make it? I don't know that I know as much in terms of data. Sorry to put you on the spot, Nat.
Okay, with COVID coming through, what's been the major issue as far as data collection is concerned? Because the actual spike that you've seen with rental loss was not predicted. So how is the data considered to be accurate? Because a lot of people are not really registering as homeless, rental assisted, etc. And I would have thought you would have been overrun with a lot of problems because of the number of people through the COVID exiting housing, etc., would have caused enormous problems.
So I can answer probably for the housing bit, maybe not the homelessness data. Certainly the housing bit for us, it has been poignant. You'll see that the joint wait list for housing, for the department's joint wait list, which is where we house people from, has gone from, I think, 16,000 people pre-COVID to now 19.5, I think was the latest figure that I saw. So that bit of data is certainly there. The data is there for us as housing providers in just the number of cold calls that we get from people who have been exited from housing and are just desperately calling anybody that they can to try and get back into the system. Unfortunately, we have to redirect them to the joint wait list. So that from a housing perspective, we're at a very, very pointy end right now, I think, and it's certainly not looking like it's getting any better. In terms of homelessness data, though,
I think we saw yesterday Paul's data indicates an increase in that rough sleeping population and others, also in the prevention, so in earlier spaces as well. Certainly the data that the department has and the data that the by name list has will show that those numbers have increased month over month of the last 12 months.
I'd just like to also share some work we've been doing with Circle Green, who are a legal service, and some of the services like Anglicare WA, and their data has showed an enormous increase in evictions. And Circle Green certainly have been finding it very, very difficult to work with people to get new homes. Because they're not available in the private rental. And if you look at the Anglicare WA data, the increased costs for support, the Vinnie's data, the increased costs for support, people coming saying we can't afford our rental, we need emergency relief money. And Lottery West have put a huge injection into the emergency relief bucket of funding because services were so stretched with people requesting support for rentals. I know Leanne and Tony are here from Centrecare.
I was just going to say Leanne's data yesterday in terms of entry point. And I think the other comment that I think most agencies are now making is that they are seeing a new wave of people who have never been in the homelessness space, many who were actually employed. So I don't know if you want to make further comment, Leanne, but I thought Leanne's data yesterday was really compelling around the increased number of people that are calling through for support.
I do have a couple of questions as well, but we can go to Leanne just quickly if we can, and then we'll zip back to questions.
I just think the amount of people calling for need has increased greatly, John, in response to your question, and people are desperate when they're on the phone because they've got nowhere to ring and they do actually want to speak to someone as well as have referral options, and there's nowhere to refer to. But our new particular service is working well and still able to help people get private rentals.
Thanks. There's a question, I think, down here at the front. Sarah, keep running.
David is going to speak soon, so we might move on. We do just have a question from our Zoom audience, if that's okay. So one of the questions, a question for Tina. Does Noongar Maya Maya offer or will they be offering cultural training for other members of the homelessness sector?
Absolutely. That's what we're working on now, and we have approached Department of Communities and other organisations, obviously, that we're here, and all you need to do is contact us. So yeah.
Okay, lovely. We might just put that link in the chat for that person who asked that question. And we just got one more question that John Berger's going to answer. What is Department of Communities actually doing to increase social housing stock proportionate to demand?
Well, I think that question might be answered with the Minister coming at 2 o'clock.
I think the Minister might be better placed than John.
We can wait for him.
Yeah.
David.
My question is just building on that data. The Zero project, when the dashboard came up, I noticed it included diverse gender. My question is, do you capture diverse sexualities? Because we know that queer people are often at greater risk of mental health issues, whole range of health issues and that. Is that data being captured? Do we know how many of the LGB, because I could see that you had the T and the I there, community are in that data set?
Nee, are you here? Anyone from my team that can help me? Kate, do you know? Oh, bugger. Let me get back to you. Oh, you are there. Yeah, okay.
It's Nia from the Zero project looking after the by name list. If the data is captured on the VIS with that, and it's also in a consent form that allows people to self-identify. So if they answer truly, then we're collecting it on by name list. Yep, yes. Yep, definitely.
I have another question online from Tina, for Tina. The question is there any discussion about funding local ACOs in other areas to develop Aboriginal housing first principles for their peoples?
So we're currently working with Wanjning Aboriginal Corporation, and we've also got some awesome partnerships with all the 3 other Aboriginal housing providers under Shelter WA's guidance. So we've come together with the Southern Aboriginal Corporation, Aboriginal Corporation, GEO, the Goldfields, Aboriginal Housing Corp, and also Murchison. So we work together. We'd love to build a housing peak. And then, yeah, absolutely.
Yep, so that works. And we've got a question
for Tina. Kaya Tina. I'm Indigenous. My question is, has Noongar Mai approached SWALS in regards to funding for housings? Because they received that large payment, payout. Have you thought about approaching them? Because we need an Indigenous aged healthcare, homes, Indigenous health homes, aged care homes and housing. So maybe approach them and put the hard word on them for funding.
Yeah, so Noongar Mai, we're not a registered housing provider. It's really hard to become a registered housing provider, and we just don't have the resources at the moment, but we are working towards that. And I do believe that is part of the criteria to be a registered housing provider. So unfortunately, we can't, there's no point in us yet, but we will be definitely working our way towards that, and that will be an awesome achievement. So we're hoping we're working on it now, and we're hoping to go for it next year. So it'll open up a lot of opportunities.
I just wanted to inquire, is mental health regarded as a chronic disease? Oh yeah, Colin.
Colin, can you hear that? Did you hear that question?
Can the person repeat it?
Is mental health regarded as a chronic disease within the health system?
I'm not sure what you mean.
Like mental health is people with mental issues.
So can I just help you out there? So Colin, she's referring to the chronic health diseases that are dealt with in the health department, the list of what is a chronic health disease.
Oh, got you.
My understanding is no, that it is not.
Yeah, that's a really good question. And I'm not fully across that. Deb probably has your answer is probably more accurate than mine would be, unless there's other people in the room who might be able to respond to that. I see a couple of names of people there who might know the answer to that.
Deb's answered, I think.
I think definition unless of course it's a permanent disability, which then sits in the NDIS. So.
Thanks. Do we have another question? Nat, you've got your hand up.
Thank you. Mine's probably an opportunity disguised as a question. Under the guiding hand of shelter, the housing providers have been working for quite a while now to get a Cert 4 in community housing off the ground. And Tina, the Noongar Mai Housing First principles and the work that you're talking about coming out of the 100 families, to me look like delicious little modules to go into that, to get some structured learnings through housing providers. And I think then there's possibly also an opportunity to roll that out to private agents if we're talking about, so let's catch up.
I think that's an excellent idea, Natalie. Look, that's actually about all the time we have. We've got quite a lot to deal with. I just want to acknowledge as well, I didn't in the beginning, our sponsors, but we do have a number of them. And actually today I do have a sort of formal sponsor announcement at the end, but I've noticed that Fleetwood Australia is here. So Dominic and Ahmed, welcome, and thanks for your continuing support. I'd just like to, for us all to join and thank our panelists today, Deb, Tina, Alex and Colin. We're going to take a short break for about 15 minutes to grab a cuppa and we'll set up for the next session, so don't go away. How much jam? Quite a lot, actually, I would think. Yeah.
No, I know. Shall we just get the photo, actually, just a quick one?
Okay, so, is that on? Yes. Thanks again. Hopefully you've had a cup of tea and muffin or whatever it is that takes your fancy. We're going to get stuck into the second session. We're going to hear from some incredible speakers. We've sort of shuffled things around slightly to suit, but Sandy has now arrived. She's been magically teleported here from Geraldton, which is fantastic. So I'm going to invite out onto the stage and we'll run it in a similar way that we did last time. There'll be a short presentation from each of the speakers and then the opportunity for some Q&A. So joining me on stage will be Sandy McKiernan from the Youth Affairs Council of WA, David Gibson, who's the project manager of Living My Best Life, and Elise Haddleton from Shelter WA, the Hear of My Experience or Home project. Can I get those three out on stage, please? Yes, give them a little welcome. Thank you. Sorry, I should have done that. Yeah. And, okay, Trish is in the second row. Great. There's definitely room. So Sandy, I might start with you and we'll roll through the presentations and then we'll come back for questions. Thanks.
Thank you very much, Kieran, as I bring it down. Apologies for my voice. Having two grandchildren under 2, you get exposed to things, definitely not COVID. I just really want to acknowledge the traditional owners of the land which we meet on today, the Whadjuk Noongar people. And the reason I'm in the second session is because I was on beautiful Yamaji land yesterday and this morning up in Geraldton. So apologies and thank you to the group for sharing. I'd hear from, obviously, for the Youth Affairs Council to sort of look at the priority area for strategic action to end youth homelessness for people who are under 25. And I really want to just give you a bit of an update on what's going on in that space, but also share some of the work that YACL's been doing. This year's theme is very pertinent to when we're discussing youth homelessness. As maintaining health and housing security of young people is absolutely essential if we're to maintain the health and well-being of the broader community. Despite making up 12.5% of our population, young people represent 21% of people experiencing homelessness. We know that many of the drivers of youth homelessness have worsened through COVID, and that this statistics are actually likely to be an underrepresentation. Family and domestic violence, poverty, discrimination are all significant threats to physical, mental and financial well-being, but also the highest risk factors in young people experiencing homelessness. For YACWA, it's crucial that we focus on intervening early and disrupting these drivers of youth homelessness. As we all know, the best approach of ending homelessness for current and future generations is to take action to prevent it before it begins. We know that the longer young people experience homelessness, the more likely they are to experience entrenched homelessness again as an adult, with a reported 50% plus of adults currently experiencing homelessness have been homeless as a child or a teen. As a result, our young people are carrying lifelong traumas, mental health issues, and frequent interactions with both the health and justice systems. And if you've been under a rock for the last 3 weeks, our youth justice system is already in crisis. Sorry. So when we talk about housing homelessness and health, it's important we shine a spotlight on youth homelessness and recognise the important approaches that intervening early to prevent harm and keep young people well. Young people are facing worsening threats to their ability to maintain a healthy and secure living. The global pandemic, rising inflation, inequality, declining rental affordability, stagnating wages, climate change, the list goes on. They're all fueling both an increasing sense of fear for young people of the future and greater difficulty in maintaining safe and secure everyday living. We hear from young people say, what's the point? The climate is crashing around us. We can't afford our own home into the future. As a result, the risk of homelessness is more prominent for young people than ever before. Last week, Mission Australia released their youth homelessness report based on their 2021 youth survey, which is about 20,000 young people across Australia. For the first time since 2017, it was reported in that survey that 1 in 20 young people under the age of 25 experienced homelessness for the first time, and in the highest rates we've ever seen in 2020, 2021, peak COVID time in Australia. Additionally, more than half of those young people who reported that experienced both psychological distress and discrimination. We see a higher rate of young LGBTIQA+ young people experiencing homelessness with great impact on their lives. For many years, we've failed to identify youth homelessness as a priority, and that's an issue that requires a separate and targeted agenda. The evidence is clear. The shorter a time a person experiences homelessness, the better. The better for their health, better for their mental health, and better for a positive community engagement. When young people are experiencing homelessness, we need to get them into safe housing as soon as possible with an age-appropriate model of care. Young people are not just little adults to fit into adult services. It's clear we can no longer continue to proceed with a one-size-fits-all, and you all know that. And ending homeless takes into account the unique needs of different cohorts, and it's really great to see our strategy starting to sort of explore how we deal with homelessness for different groups of people. It's time to develop a resource and deliver systemic approaches that recognises the unique nature of youth homelessness and provide young people the support they need to exit homelessness permanently. So this in mind, YACWA is moving forward with a few projects over the next couple of months that we hope will foster a great community approach of addressing youth homelessness with specific programs and interventions that we hope will roll from the work that we will do. In particular, we're bringing together young people and experts in this space to understand what a Housing First for Youth program looks like. We've established quite significantly a philosophy of Housing First in our homelessness strategy. What we need to do is apply that to young people because it's different. Young people need the developmental overlay requirement. If you're 15 and experiencing homelessness, you have a very different view of the world than someone who's 40 or 50 and has been an entrenched adult and experienced a range of life sort of examples. Equally, young people don't have the life experience to move straight into a house. Looking after a home takes skill, money, resources, often which if they've come from an environment where that hasn't been modelled well or they've not experienced it at all, we're setting them up to fail with a true Housing First approach. Housing First obviously about choice, we know that, but for young people that means sometimes a share house, sometimes means supported living, and we need to ensure that we have that very person-centred approach. What we'll be doing in the next little while is that we have, through support from the Alliance, gained some funding to look at the national and international literature on Housing First for Youth. There's some great examples in both Canada and Ireland and other parts of Europe where they're really having great successes in really sort of pinning down what that model difference looks like. We'll be looking at that evidence and then having our own sector, the homelessness youth organisations come together to work out how do you apply this here in WA? How does this work both metro regionally? And that we hope will then be the beginning point that we can hand and work with the department and Jackie and her team to say this is how we think Housing First should look for youth should look like here in Perth and in WA, and let's find some pilots and let's model that. We also have a fantastic, and we're very excited to sort of say that we'll be relaunching our Youth Homelessness Advisory Council. Some of you in the room will remember a few years ago we had some funding around the time the Alliance was establishing and doing the great work on establishing the sort of strategy to end homelessness. The Youth Action Plan was developed and with a lived experience group of young people. Through the mechanisms that that happened to us, all funding ended for that project, but we've got 3 years of funding to re-establish, rebuild, and really bring the youth voice back into the homelessness agenda. So I'm super excited as the sort of brand new CEO of YACWA to actually be able to bring that back to the table because it's it's the missing gap for me. So through these two projects, we're really going to look at how young people have been overrepresented and overlooked for such a long time and really bring that back to the fore. We'll be updating you all with the projects as they get off. I'm hopeful after this afternoon I'm going to have a talk with my manager who's got, we're going to appoint a youth development coordinator to run the YHAC, and I'm hopeful that we've actually got to the end of that process today. But thanks everyone. We just really need to make sure that we look after our young people in the homelessness conversation. Thank you.
Thanks, Sandy. Look, my apologies. I forgot to mention this just before we started as well. There's been a slight a potential change to some of the email correspondence you may have received around this, but just to clarify that the Minister will be here with us at 2. This panel will run through till just before then, and then the Minister will be here. So apologies if the timing on your emails or invites doesn't align with that, but the Minister will be here from 2 till 3 to take questions and to talk to the audience. The next person, David Gibson, please.
Kaya, and can I say, whilst the weather isn't great, it is always beautiful to be here on Boorloo and recognising our Indigenous elders for all that they have done for us in this community. As you can see, my name is David Gibson, pronouns he, him. And I'm taking dibs on having the best job title in this room, if not in my working life. 54 years it took me to get the job title of being the project manager for Living My Best Life, and I'm finally doing it. So I'm going to talk a little bit about this program, what it means, and give you an update on how it can be of benefit to your organisations. Because the program itself, Living My Best Life, is about supporting organisations who support people who are homeless and also have psychosocial disabilities in making an access request for the NDIS. So Living My Best Life is a capacity building project. It's designed to assist both NDIS providers and those in the wider sector build with knowledge and skills in making an NDIS request, access request. And I just want to do a quick show of hands. Has anyone in this room made an NDIS access request? Has anyone been successful with their NDIS access request? And we dropped to 50%. That's not bad, okay? That's pretty much the experience of where we're at. The rationale behind it was for people who are making an access request with a physical disability, about 90% of applications were approved. If you have a psychosocial disability, that dropped to about 70%. So there was a big gap, and it was identified as part of the transition as WA was moving across to the Commonwealth system. What could we do about that gap? And thankfully, the government had a sector transition fund, and we've been able to fund this project from the Department of Communities. And it's a joint project delivered by Richmond Wellbeing and with RUA. And we provide a whole range of activities and services for organisations to be trained and skilled up, because we want to move that 70% closer to the 90%. And interestingly, and I'm not completely sure on this, but it may be as a result of just, I think the last quarterly dashboard from the NDIS showed that that had actually dropped as a percentage, but that may be due to more people making an application as a result of COVID and mental health issues, and them not being not having a psychosocial disability. So there are a couple of factors in that we're yet to draw through. So let me give you some quick stats. There are about 600,000 Australians living with a severe and persistent mental illness. Of that 600,000, 290,000 of these people require support periodically. Of that group, only 64,000 are estimated to be eligible for the NDIS with psychosocial disabilities. Now we come to the figure of who has actually got a plan. So that's what they were estimating. Most current data, 27,974 people have an NDIS plan, and this is across Australia, have an NDIS plan with where the primary disability is psychosocial. Compare that to the 308,586 people who have an NDIS plan. So we get a feel for where psychosocial disability sits within the NDIS, how difficult it is to get, and how few people have actually got it as their primary disability. So when Living My Best Life started, it did extensive consultation. It spoke to people who had plans, people who had applied and been rejected, people who didn't want to apply for an NDIS plan. It spoke to organisations, both who were registered NDIS providers, but also organisations who just out of the goodness of their heart, because they're great people, got out there and were supporting their people to apply for the NDIS. And a whole bunch of data came back. Most of it told us what we already knew. There is a range of barriers for people with psychosocial disabilities applying for the NDIS. I'm not going to teach you guys the psychics because you know the intersectionality between homelessness and psychosocial disability. You also know the intersectionality about alcohol and other drugs and homelessness. And all of that plays out when you're trying to apply for the NDIS and having evidence to be able to do that. So as a result of all the research that was gathered together, Living My Best Life, because we couldn't call it this, no disrespect to the department, but my God, it had a boring name. It was a sector transition fund, blah, 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 blah. It's like, no, I'm not going to be that project manager, okay? Living My Best Life, claimed it, it's mine, you can't have it. So Living My Best Life developed from that. And we took what we heard, we took what we learned, and we brought it together in a bunch of resources. And one of them, and this is not a comic, it is a graphic novel. Okay, I just really want to stress this, very precious about it. But we developed this resource to underpin everything we do within Living My Best Life. And this graphic novel is based on 5 characters, and their lived experiences, their stories that we garnered from the whole range of areas have been brought in and placed across the 5 different characters. From a homelessness perspective, the character Brad, the chap with the tattoo, is the character who tells the story from a homelessness perspective, also recently having coming out of jail and having AOG issues in his past. So when people are looking at this graphic novel, whether you be a provider, whether you be a consumer, you will see the stories of people that you engage with, and it's deliberately designed that way. It also talks about the barriers, and we did everything except swear in here because apparently I wasn't allowed to do that. But it's real words. It's not about navigating through a website with government jargon. It talks about it in a way that people can see and relate to. It's also low tech. The beautiful thing about this is it doesn't matter if my data plan has run out and I've still got a week before I get any money to go through. It also is great because if I'm not feeling well right now, I can throw that down into my backpack and I can pick it up later and look at it when I'm ready to be able to go through. I don't have to come back to a web page that I bookmarked. I don't have to try and go through my history to find out, where was it that information was being talked about. It can be rolled up, thrown in the back of your jeans, and it can be given to a friend. And that's how we've designed this, that it can be shared and used. It also talks about the barriers that people face from a perspective of what are the challenges so that consumers, GPs, others can actually read this, see the story and go, oh, I thought gender dysphoria was a legitimate disability that could be claimed under the NDIS. Because one of the characters is trans, and that's their story drawn from the experiences that come through. I want to talk a little bit about Brad, and I just want to give you guys a quick insight into his story. It's very short, 45 seconds. Actually, that was a shameless plug for the training. So if you're interested in obtaining the training or accessing it, please do check out the information that is there. I'll see if I can move on to the next slide. Yes. You'll see our socials, also the, if you Google, you'll see the website information that's available. Now, why is Living My Best Life relevant for homelessness? Because we know that the NDIS does not fund anything to do with homelessness in a person's disability package. It's relevant because of all the reasons that you already know, and I'm not going to, bore you with them. But if we can get people, and I'm not, and I'm very, very conscious of, obviously the housing first is an important area, but if a person can get an NDIS package because they have a psychosocial disability, it may not be housing first, but it may go away to helping them in the other areas that they need. And so I'm not, not sort of dishing on that, but just acknowledging that there is often with government streams of funding, we need to pursue what is available. We want to do what we can to be able to support people to get an NDIS package for those who are eligible. And the largest part is about navigating the system, getting the right evidence, understanding, and this is, I just love this story because it's just so fascinating. True story, came from one of our the people that involved from RUA, where a person was making an application, emailed it off, hadn't heard anything. Okay, emailed it again, hadn't heard anything. Third time, emailed it, rang. No, we haven't received your application. Then we found out that the NDIS email system won't take files that are greater than 10 megabyte as attachments, but they don't send you back an error message to say, this has been. So you have that disconnect in that space. Now, what was really sad was the fourth time the email went through and the rejection occurred on a Friday, if I've got this right, and the rejection occurred on the Monday, I think. Wednesday and a Thursday, even better. So they're incredibly efficient at rejecting because the evidence that was gathered was one of the boxes was ticked that showed that it wasn't permanent. So what we want to do is we want to really be able to support, skill, and bring people together so that they can better support their consumers and clients so that in applying for the NDIS. The training is all free. There's a range of resources. The graphic novel, as I said, underpins everything. There's online and face-to-face training. There's also animation videos that are available on the different characters. There is a mentoring podcast, and that whole idea is there are 14 episodes. Each of them are being released to be available as a resource. So if you've got new staff coming through, because we know within the sector there's a high turnover of people, you can actually say, hey, just listen to this on the way to work tomorrow or on your way home. It's about gathering evidence and it'll give you some tips as to what's really important. And we're about to launch a community of practice and it's all free. So thank you so much for your time.
Straight up. Okay. Hi, everyone. So we're going to be... Can you hear me now? Just for you. I'll take my mask off. Hi everyone. We're doing a soft launch today of a brand new project, phase 2 of one that's been running for a while. So before we begin, I would like to say kaya and acknowledge that we are on the lands of the Whadjuk Noongar people today and to pay our respects to elders past, present, emerging and Aboriginal people who are with us today. So project that we're going to be introducing you to is actually the second phase of a project you may already know a bit about. It's called Home, Hear of My Experience. And so I just want to say that we are coming off of the back of a lot of really amazing work that has been done by people over the past few years. So I'll give you a bit of an insight into what has happened so far and also where phase 2 of this project is heading. And now I'm going to hand over to Trish.
So, hi, I'm Trish Owen. I'm the project officer for this project. Some of you may remember me being up on stage last year. I think we did a launch of a toolkit and a framework to teach you how to engage with people with lived experience in all levels of system change that needs to happen. So you can still access that framework. The start of this was back in 2018. We launched with Shelter WA, there were 17 people with lived experience, some of whom are in the room. So I just want to acknowledge Deb and Al and Josh was here and myself were, Jonathan, can't forget Jonathan. We're a part of those 17 people with a lived experience that were consulted to develop a lived experience engagement toolkit. After that, there was some more funding where and it's a little bit backwards, where 2 of the people of those 17 were engaged to develop a lived experience engagement framework. That framework is available on Shelter WA's website for you to get an insight in how and why and where we need people with lived experience. It's got principles and things involved in that. And as I've heard a lot over a couple of days that I've been here, there's lots of stuff going on and there's lots of interactions and we need collaboration, and I've heard a lot of the buzzwords. And one thing that this project going for, thank you Sisters of St John of God for the funding for the next phase of this project, is we need the voices of those with lived experience throughout all levels of system to change. Like that is a missing piece of the puzzle in a lot of the areas that we can see systemic issues and problems with. So as some of you may have been here this morning to hear Jonathan's lived experiences, he was up here talking about the intersects of homelessness and health. Now, I don't know about you, but after listening to that, the emotionality and the weight of this work was sort of sitting with me. I'm supposed to give you a definition of lived experience. So on my little badge here, it says Project Officer Home, and then in brackets LEX. Now, the lived experience expertise is what we are going to be upskilling people who have a lived experience of homelessness, so that they can utilise that expertise that comes with having lived through the disadvantages of this system and all the intersects and all the things, because I don't separate my lived experience of homelessness, housing insecurity, mental health, AOD issues, family issues, DV, whatever my personal lived experience is, I don't separate that. But I've got to access different parts of the system. So this project, and I'm going to hand you back to Elise to tell you where we're going with this, will teach us, and I say us because I've heard a lot of us and them language happening, and it's like we are all in the system together, right? And together, as I've heard of the little the collaborations that are going on, together we can actually make a difference. So I've lost my words because I heard the click click of the camera and I just went, what does my hair look like? So fabulous, fabulous. So I'm going to pass you back to Elise to give, because she's been working on, now we are in our 3rd week of employment. So at Shelter WA. So those of you who have started a new job know what that's like, and it's like, so we're getting the frameworks of the 6 projects, but you can already engage in a taste of 2 of them. Yes. That's exciting. Now, today, anyway, I'm stepping back.
Thank you, Trish. So Trish has actually done a great overview. So we're not starting from scratch because of phase 1, but phase 2 is taking that next step towards actually acknowledging that having lived through an experience, having been on that journey into homelessness and surviving homelessness and all of the things that it intersects with, that in itself is a skill set, but there are other skills that we also need. And I say we because everyone who's part of the project has lived experience of homelessness, myself included as the project manager. We need other skill sets as well. The ability to determine how much of our story to share and when, whether or not there are other ways that we should be going about communicating, understanding how policy is made and how the system works and who we need to speak to. So there are a whole range of skills that are involved. And the next phase of this project is actually about building the capacity of people with lived experience to actually engage with the sector in a professional and truly expert capacity, and also to bring the sector along on that journey as well. So actually about building a better understanding of, well, what is it that organisational readiness actually refers to? What does that mean? What sort of things do we need in place in our organisation to make sure it's trauma informed, that it's culturally secure, that we've got a bit of an understanding of what lived experience as an expertise means, how much should we be paying people, all of those kinds of questions. So we are really grateful because this is such a big project. We're very grateful that we've got 3 years to actually unpack all of that work and take everyone on this journey with us. And our thanks to the Sisters of St John of God for their very generous and wonderful support of the project. So you've heard the reference that Trish made to 6 sub-projects. So we've got the overarching governance, this is the home project. All of these sub-projects are taking us on the same journey towards the same outcome of actually having a lived experience voice informing the sector. But within that, we've got 6 sub-projects. So I'm just going to give you an overview of those because we've only got probably a couple of minutes left now. So we've got an education support program for people with lived experience to help build their capacity around sharing their stories and engaging with policy change and sector change and system change, speaking with the media and all those kinds of things. We've also got another sub-project which is about rolling out that toolkit to the sector, so actually delivering workshops led by people with lived experience so that you can start to implement that toolkit in your workplace. So we're at the stage now where the pilot is being rolled out, so you'll see more news coming up on that in the coming months. We also have a communications bureau, and this is something I'm really excited about because so often we hear about people with lived experience just coming in to speak and to share their story, but there are so many other ways that might be more appropriate for someone to share and bring about a change in perspective, especially when we're talking about something that's so heavily stigmatized. The number of times that in my previous roles, I've tried to find images that really show what homelessness is about and some of the drivers of it. And you've just got these stereotypical images that I don't see my journey in, Trish wouldn't see her journey in. And so that's a large part of actually changing the system, is changing those perceptions and bringing other ways of seeing this issue to light and the journey that people are on. So that will be a bureau that people can access all types of communications, whether they're in schools or government or NGOs or somewhere else in the service system or in the media. And people will be paid for their intellectual property. There's also the immersive tools, and we've got wonderful Josh. I think he might have popped out again. He is actually running some of those tours this week, and there's the one that's happening straight after today and this talk. So we've got his tours already underway, but also we're going to be building his capacity to run lots of different types of tours as well, and to turn that into a small business. There's also phase 2 of Street to Street, and wonderful Deb is sitting over there. You can have a look through some of the work that was done in phase 1 of Street to Street. In phase 2, it's really exciting. We'll have a proper launch where Deb can share all of the work she's put into getting some funding for phase 2 and her vision for that, but it's really exciting stuff. So this is about professional artists with lived experience of homelessness, collaborating with people with lived experience of homelessness and with the sector, to use art as an engine for social change. So that there's some really exciting announcements to come in that project as well. And the crowning glory of the whole thing is this council, which is going to be independent. So our role is to just get that up and running. And it's going to, so we'll be doing training and inductions, helping people with lived experience to understand what is a council, what is the role, what are the governance requirements, all this kind of stuff. And then the aim is for that to become independent and be with us for a very long time to come. So sorry about the quick run through. There'll be a proper official launch coming. I'll let you know via socials and the news that comes out of Shelter when that's coming. But thank you so much for listening today. And I'm going to hand over to Trish for a call to action very quickly.
Quickly, what can you do? Come and talk to us. And this is a networking event. So come and talk to us, get our contact details. They are somewhere back here. Come and talk to us because I think I'm going to run out of time. And we'd like to thank the Sisters of St John of God and Shelter WA for funding this work.
And find us online. That was so good. Sorry.
Okay, thanks. It says here I've got 11 minutes to wrap this session up, but probably now I've only got about 10 and a half. Are there any questions from the audience of the panel? Can't see if we've got some. Any questions? Yep. So we'll get you to speak into the microphone so that Zoom people can hear too.
Yep. You only have one of those?
Oh, no. We have a whole bunch of them
Oh,
here.
cool.
So please
Yeah.
take one.
Yeah,
if you're
awesome.
leaving
Because
today, yes.
awesome, yeah. Because I want to take that to our Indigenous Health Centre and our brain injury meetings as well that we'll go to. So I'd like to disperse them.
More than happy to get as many as you want. You just ask and they come.
Thanks. We've got a question here, and then I'll.
Actually, I did want to follow that up. It's fantastic to see that work. And I think there is an interest. Michael Pugh just texted me to say he's really interested in looking at this in homelessness and the general more applicability. My question, and it's probably broader though, in terms of the uptake from our Aboriginal people in terms of NDIS, I know that there was meant to be a lot of national work on that in terms of they weren't accessing it. Has any of that shifted?
Not that I'm aware of.
That's a depressingly short answer. We'll go just behind you, Deb.
I'm going to do a quick double question. Firstly, I forgot the lady's name.
Sandy?
Sandy, that's right, thank you. One of the major things that really is a taboo spoken problem to do with the young girls, the sex problem to do with that. Okay, so it's not really spoken of, it's not really dealt with. What actually are you capturing as far as the problem to do for the prostitution in regards to selling themselves for whatever it is just to get by?
You're absolutely right. It's a very hidden problem. When I first came into the sector, I heard about survival sex as a real thing for young women and young boys, just sex for favours, whether that's couch surfing or financial. The data, I'm not the right person. I think the agencies that sort of work in that space probably will have a little bit more. I do know the Youth Homeless Services deal with it in partnership with the name escapes me, of the sex workers group, and we did quite a bit of work in sort of training youth workers in this space to how to recognise it and how to support young people in sort of decision making. The reality is it's happening, and I don't think it's really well understood, the depth of it at all.
Thank you. I think Deb had a question. Oh, sorry, Alex, I'll come to you, Alex, and then straight to you, Deb, promise. Yeah, you got the mic.
Thank you. Firstly, this is a question for Trish and Elise at home. Congratulations on the funding, because I feel like this is a project that's very much needed in the sector, for the community service sector and for government. So my question really is, how long is that funding for and how much capacity do you have? Because I feel like, and I hope you're going to be inundated with requests. So yeah, how much can you do?
Thank you. Yes, so in the rush of going through it all, that was an important thing to leave out. We've got 3 years of funding, and the paramount objective of that is to create something sustainable that will last well beyond those 3 years. So there's a lot of a component of that funding towards actually upskilling people with lived experience in order to actually have pathways to employment. So whether that's a small business that they want to start as a consultant and understanding the obligations sort of taxation wise, or maybe it's about actually moving into a pathway that's actually probably more secure, actually having a career path within an NGO or even within the public service. So it's about actually supporting them in finding that pathway, navigating what training is required, and there is some funding to support a number of people in that. So it's not an exhaustive amount. Part of my role is to actually source more grant funding to ensure that that is sustainable and we can help as many people as possible. But another aspect of the project is also making sure that the people that we are upskilling, including in the advisory council, including in our governance for the project, actually do represent the demographics of homelessness. So we know that Aboriginal and Torres Strait Islander people are appallingly overrepresented in homelessness statistics. So one of the first things that we'll be doing is actually making sure that we are talking to the right people and getting advice on how to include culturally secure practices right from the very beginning of this project. So I don't know if I've answered your question like really fully, but with all of that in mind and making sure that it's inclusive of refugees and migrants, women, people with disabilities, LGBTQIA positive people, with all of that in mind and the constraints of the funding and the hope for more, I think we can do quite a lot.
Yes, sorry. I just want to add, like, as part of the continuation of the funding, like it depends, one of the answers to those questions, it depends on how much the sector takes on these valuable resources like the toolkit, like the street to street project, like the immersion tours, like these are in the planning that we're in the midst of now. It's to develop these sustainable tools so that, a toolkit, so Rua want to learn more to advance the work that they already do, engaging the people who access their services, then they purchase lived experience people to come and teach them how to do it better. We're doing great things, and like that's been evidenced today, but it's like we need to acknowledge where we've gone well and then continue to ask the question, how can we do better? And the resources that these projects will develop, like the toolkit, like the Lived Experience Advisory Council, basically they are an addition to the good work that's already been done, because the voices of those with lived experience and all those cohorts that are overly represented, those voices maximise will help us as a system to fix a really broken system.
Great, thank you. And it's so good to have Trish, you wearing a Shelter WA badge today. I'm very proud. Okay, Deb.
I've got a question for you, David. I was looking at listening to your spiel about what you're doing, and I love all the animation as an artist. I think that's brilliant and very inclusive, and will cross very broad spectrum of people who are possibly looking at NDIS as a service. So my question for you is, I know from, as a lived experience point of view, that when you're on the streets, it's very difficult to work on any aspect of recovery when you're in fight mode on the street. Highly unlikely people will access NDIS whilst they're still on the street. But I do know the services that you launch, definitely in transitional housing and service providers will access that. So I'm wondering, how would you be able to implement, and also the service sector, implement NDIS to people who are on the street? How can we kind of cross that bridge? Because there is a bit of a gap there, but I do think what you've got is really brilliant. And this could be a question to maybe process rather than, and has there already been something in mind about that, or is that something that maybe that gap you can look at now?
Certainly the research identified that barrier, particularly with regards to evidence, because even just the initial, being able to meet the eligibility criteria of what's required, people may not necessarily have copies of the required paperwork, if they're sleeping rough. So we acknowledge that the Living My Best Life is about training other organisations, about training them to deliver that. So we've had some amazing training sessions where quite literally conversations have come from the participants where we're like, okay, we weren't aware of that. We've shared it in future training sessions to go forward. So it is a resource that is constantly evolving based on the feedback we get back. You're absolutely right in the sense that there is a gap, and no one is dismissing that, but individuals can apply for the NDIS at any point, and even if they're rejected from the first time, they can come back and make a second application with the right evidence. And so sometimes that might be a person started the process, became homeless, and therefore that didn't complete, and then they're coming back a year later, 2 years later, 5 years later, and following up on that and pursuing that once they've got other elements of their life with a greater foundation.
Thanks. Look, in terms of timing, that sort of wraps up the time that we have at the moment, and that was a great update, I thought, across the sector. I mean, some incredible work occurring at all levels. We're going to take a short break and come back with the Minister. I just want to thank, while we have a chance, our sponsors for Homelessness Week this week, which include Beyond Bank, Fleetwood Australia, Uniting Church, the City, Lottery West and the Department of Communities. Without their support, this event really, or this series of events and fantastic conversations wouldn't be happening. And I'd also just like to take this chance, and if you can join with me in thanking the guests on stage for their presentations today. Show bags. So take a quick break, grab another cup of tea or water, and we'll be back with the Minister. I have.
SBS live streams and podcasts are supported by advertising.
SBS Chill.
If I can get you to take your seats again. Should be getting practiced at this, just hopping to your chair. Yeah. Sure. Okay. If there's anyone here who's booked on the tour with Department of Communities, they'll need to head out now. I think we're meeting in the foyer or just out the lift. Foyer. Yeah, if there's anyone. I think most of them have headed off for that. Okay, great. So thanks for coming back to your seats one more time. And I've got speaking notes here as if we're starting from scratch, but I think we're just going to keep going and I won't do all the intros and the various things. So I'm delighted to welcome the Minister for Housing and Homelessness and Lands, the Honourable John Carey, MLA, who's just joined us. The Minister has agreed that I won't read his extensive and impressive bio. We'll just cut straight to the chase. The Minister will come and share with us some updates and some thoughts, and then there will be time for questions. So I'll take a seat, and at the end of the presentation from the Minister, we'll be asking some questions. So if I can invite Minister Carey to the stage.
Thank you, and thank you to everyone who's listening online. Firstly, I would like to acknowledge the traditional owners and pay respects to elders past, present and emerging, and recognise the country that we are here today. I actually have had the pleasure, just as a side note, to attend the launch by the Department of Communities in terms of empowering Aboriginal controlled organisation in the delivery and ownership of services. And it actually is a fantastic work that it's been undertaken by many years. And I will come back to it when discussing the homelessness portfolio. Just want to say, first of all, and I said it in my video speech, but thank you to everyone who is working in this field, particularly given the pandemic over the last few years. I know this, none of you are in this job or in this role for glory. You're certainly not in it for pay. You do it because you have a genuine commitment and love to assist most vulnerable West Australians. And I understand that the pandemic has been deeply challenging on so many fronts and been changing. And I do want to acknowledge and thank the sector for both your work and advocacy during that time. I'm here today just to give an update across the portfolios. And I do want to say this firstly, that I'm deeply lucky to have 3 portfolios that really help me leverage every opportunity that I can for both housing and homelessness. So it's obviously the housing portfolio, it's the homelessness portfolio, which is for the first time a portfolio has been created since December last year, and then having the lands portfolio. Now, some of you may have rolled your eyes because you think, oh, what the hell's that? But actually, it is a pivotal part of our social housing and homelessness program. I do want to start on housing because obviously, as we know with the housing first approach, if we are to transition rough sleepers through that journey, then we need homes at the end of it. Now, I know it sounds like a broken record, but we did make the biggest injection in social housing funding of $875 million in September 2021. And then in addition to that, of course, we announced a new remote communities fund of $350 million this year. So we're going to be spending in the housing and homelessness program over the next 4 years is $2.4 billion. but I'm always a straight shooter, and I'm always very frank. The biggest challenge I have is getting that money out the door. I really want to be clear on this, because I get a lot of people coming to me and saying, have you thought about building houses quicker? And I go, yeah, I think I'm on that. So I do want to say this. Every day that I've been the Minister for Housing, every day I wake up, and other than checking realestate.com for potential spot purchases, and I have been successful on that, I get up every day to think, how can we accelerate the delivery of social housing? Because you have to understand these challenges. First of all, we're seeing massive cost escalations. You know, the private sector reports 20%. I can go out for tenders, no one responds to build the property or wants to refurbish property. So we've been trying to think outside the box. How do we deliver more social housing? And I'll tell you how we've been doing it. First of all, and it was an obvious one to me, but was converting existing other government housing, i.e. for regional workers, that was surplus to needs to social housing. And we've done that. My agency is constantly reviewing grow housing, and where it is surplus, we convert it to social housing. An instant win, and we know even a few houses in a regional market is incredibly important. Secondly, the department was selling commercial housing with combined with social housing as part of a mix of development. So we said, where we can, convert those apartments rather than flogging it to the private market to social housing. We then realised that we have an obsession with double brick homes. Double brick homes can take now anywhere, probably around 16 to 18 months. So we bring in timber frame homes, which my East Estate counterparts laugh about, but that has been a reform. So by the time a concrete pour hits, we take now 4 months to do timber frame homes. And of course, we're doing spot purchasing. And I'll give you an example. I believe a foreign investor was selling 16 units in Kununurra, and our agency bid for it, and they will be for women over 55, for Indigenous women who may be at risk of homelessness, and providing some support for it. So that gives you an example of the tranche of programs that we've been doing, trying to think outside the box to accelerate social housing. So in the last financial year, we added 600 homes. That's 6 times from the year before, six-fold increase. We've got another 860 under contract or construction. We've also got our direct grants that have gone out to community housing. And now, with the 500 million sitting in a social housing fund, I'm looking and planning about how we can spend that money to get the best return for both community housing and for the government. And this is where lazy land comes in. So this is the second part of the picture. We have lots of lazy land. That's land in high-profile locations. So Rita Saffioti, the planning minister, and I got together and we thought, well, how do we leverage from that? So we've actually created a thing called the Housing Diversity Pipeline. Basically, it is land. The first tranche is 12, includes in high-profile, expensive locations like East Fremantle and Como. We've gone to the market and say, what can you do for us? We want a 1 in 5 social housing return. Could be community housing, could be government housing, but we want that return. We've had incredible interest, and now we're working through that process, but we had about 60 different community housing providers and private sector interested in that. So we're working through that. A second tranche is coming. We're also doing some other individual areas like Smith Street, which we've specifically gone out. So that was an old tower in my electorate, Smith Street, where we've gone out to the market for community housing on a build to rent model. And so we're looking at that land, and we may, in that land, provide it as a ground lease. We might provide it discounted. We might sell it, well, who knows? But the idea is we're trying to create flexibility. In addition to that, we brought in a tax incentive, which is build to rent, a 50% rebate on build to rent, so that we create an incentive to do build to rent, which is generally targeted towards workers' accommodation, but also can include community housing. So that's what we're doing on the land front and the housing front. And then the third front, of course, is homelessness. And in that regard, obviously, we are trying, and I will deal with an elephant in the room, we are trying to drive and deliver on our key, our key works for the homelessness sector. So our commitment to deliver 2 common grounds, one in East Perth and one in Mandurah, which is around $75 million. I think I'm talking to the converted, you know, the common ground approach, which is providing accommodation for rough sleepers long-term with intensive wraparound support services based on successful models around the world. I'll be frank, last week up front, we did hit a roadblock when the assessment panel, a multi-agency assessment panel, came back to me and said that the tender wasn't satisfactory. Means that we're going to have to look at how we rework that contract model in a heated construction market, but my commitment is going out as soon as we can, back out to the market. We're also progressing with Aboriginal support accommodation, which includes in the city, if you're not aware of that, that is supported accommodation for transient populations of Aboriginal people, providing a culturally appropriate location. And we have new commitments for Geraldton, Kununurra and the city. We are also, of course, funding and doing the Housing First approach, which you're well aware of. But I want to say, and I do want to flag here, that we are looking at how do we better leverage and better coordinate from the investment we make. So last year, we invested around 190 million in homelessness programs and works. That's a significant investment. And coming in as the minister, it is clear to me that we have a lot of different providers who are all doing brilliant work, but they're all working away. And I do think that we can do 2 things. First of all, in accordance with the Housing First strategy, is really focus on the first key element of the strategy. And that was about assisting rough sleepers to transition to housing. And that means making housing first, front and centre of everything that we do as a government. And I am looking at all of the bodies and the strategic advice and the governance around homelessness to see how we can better focus on that. Because I want to be frank with the sector, everyone says they support housing first, and yet I get proposals from different members of the sector which are pitching money from me, and there's not one mention of housing first. Or if it is, it's right down on the end on page 7 or 10. Now, as a sector, the message was, we endorse housing first. We have a strategy that says we endorse housing first. That needs to be the focus as the minister, the government, and the delivery of that strategy. But the other part is also tackling and dealing with and coordinating better the enormous outreach services, which is the first part of that journey. We do have 9 organisations working in Perth on outreach. And what I am interested in seeing is how we can get better outcomes from that. If you're not aware, we did boost funding for the HEART program. It's been expanded to 7 days a week, and it has been getting some actually good results from a sort of more strategic approach. For example, there has been a stronger focus on remote communities. That is, people who are being stuck down in the city for whatever reasons, for visiting family, for health reasons, and ending up in that awful cycle that we do see of being rough sleeping on the street. And I do want to say to date, the HEART team has assisted 57 people to return to country. And I'm interested in how we can also better provide support for people, for Aboriginal people coming down to the city and making sure that they don't get lost in the system, so to speak. And that is another focus. Of course, the other part of the reform program is the commissioning strategy. And I understand there is a lot of anticipation about that and that we are looking towards the southwest. I do want to say that I am committed to working with the sector. I appreciate that it will be both challenging and difficult, but I also really hope that the sector does embrace that as a better way forward to provide more consistency and certainty over a 5-year period, which is the aim. So there's just a taste of the work that we've been doing in housing, in lands, and homelessness. I do want to do it again. I know, just want to give a shout out to Michelle. She is leaving. I just want to again thank her for her incredible leadership from Shelter WA and wish her the best. And happy now to take questions.
All right, so hands are being raised. Sarah is coming with a mic. Once she comes to you, you can ask the question. And if we can just keep the questions punchy, because we've got a few people asking.
Thank you very much, Mr. Carey. The question I have is in relation to social housing. Could you, I don't know if you have the data, but if what I'm interested in and what we've observed as a group of people with lived experience of housing insecurity and homelessness is there seems to be a lot of social housing going to essential workers. What we'd like to see is the data of how many, the ratio of people who are not essential workers who are actually in poverty and they're at risk of homelessness and have the housing insecurity that need the social housing more than the essential workers need it. So what I'm asking is, do you have the data? And if you do, can we access that and start to have a little look at a bit of a balanced change in where all the social housing monies are going, like as in who they're being given to, all the social housing? Thanks.
Well, first of all, I've not heard that. Eligibility for social housing is very clear in terms of the income limits, and there is a priority list and a general waiting list. So obviously, as the Minister, I'm not involved in selection of tenants, but I'm not aware of essential workers being prioritised over people who are on the priority waiting list. So if there is information that you want to tell my staff, because I want to assure you, I'm just trying to get as much social housing stock added to the system as I think that's the message is very clear. I'm trying to get as much social housing stock added any which way I can using any lever I can, but it is for those people who are eligible under the priority waiting list and the general waiting list. Workers receive housing under the Grow Housing scheme if they are working in regional Western Australia, i.e. police, teachers and so forth, but that is a separate system. The only thing I've been doing is if there is vacant housing in Grow that I can move across to social to take people off the waiting list, that's what I will do. So if you've got any information on that, very happy for you to approach one of my advisors.
Quick question, please. I'm making a double banger. One is, have you heard of tiny houses where they've actually set 6 houses on a block of land? What are the chances of getting that in WA? And secondly, if you're in government housing, your whole package of what you actually get given gets done in rent at 25%. Now, Victoria and New South Wales have actually reviewed theirs and reversed the idea of taking 25% of your pharmaceutical allowance, taking 25% of your electricity and any other benefits that you're going to get. And this becomes down to a long phase of the fact that actually, if you do get work, you end up paying 25% of what you're getting in work to rent as well. is West Australia going to dump the 25% off your pharmaceutical, basically your, what do you call them, superfluous benefits without injuring what you're getting as far as an income's concerned?
In terms of tiny houses, there is some non-for-profit groups like Michelle Blakely who are doing tiny houses. And I do think tiny houses have a place. And if I can use surplus land to assist non-for-profits to do that. But I will make this comment also about tiny houses, is that often they are delivered through the goodwill of private sector companies and organisations. And my only question mark is that if you try to do it as a government, where you're not relying on philanthropic means to deliver, that the cost of delivering a tiny house, it may be just as effective to deliver units, one-bedroom units, or I might be able to spot purchase for the same price. So for me, ultimately, it is always about cost effectiveness. I think tiny houses are really cost effective if you can leverage the private sector. And I think Michelle's done it brilliantly. She's tapped into Lotteries West. She's tapped into people to effectively deliver the materials or the construction at cost price. Government can't do that. And as a result, I want to see that grow, but I'd rather be able to provide, rather than say studios, long-term one-bedroom units. Look, in terms of the 25%, I'll be frank, I haven't given that consideration. Delivery of social housing has been my #1 priority. This year we did lift the limits in recognition of CPI in relation to the pension and so forth. I'd have to give it consideration. I don't know if Shelter's made any, have they, Michelle? I'm not sure. Okay. I would be interested in catching up with Shelter about what the other states are doing. So I'm sorry I can't answer that today.
Thanks. Do we have another question from the floor? Alex.
Thanks, Minister. So I guess my question is, and you kind of touched on some advice, if in the regions, organisations, community groups wanted to approach government to seek support to create solutions, one, what is the best way to do that? And two, how are you making your decisions about which communities and which areas of the region get those solutions?
It's a good question. First of all, we've got to be very clear where demand is, #1. And that is 70% of demand for social housing is in the metropolitan area. Now, that's not to say that we don't seek to invest in regionals. And I'll give you an example. We created the modular program, which out of 200 homes, 150 are going to the regions. And in fact, the conversion of grow housing is only happening in the regions. So we really are doing programs specifically for regional social housing. Look, we do have the Social Housing Fund. It did give grants out to the community housing sector. It does look at demand. So where is the demand for social housing? That is obviously a key criteria. What is the capacity to deliver? So I have to say, I get a lot of people coming to me pitching new ideas about housing. And I love their energy and I love their passion, but not all have necessarily the expertise or capacity to deliver. And so capacity to deliver is also something really critical for me as a minister. Now, we're always open to new ideas. It may be the case that you're looking for land and we're always aggressively going through land holdings. So there are two ways you can approach my office directly, or you can go to the Deputy Director General for Housing and Assets if it's about a particular project. In some cases, for example, we've given grow housing to the non-for-profit sector. We also, on a case-by-case basis, can give housing for particular non-for-profit services that are dealing with an issue in a regional community. So I suppose the message is always open, but recognising where there is demand.
Thanks. Do we have another question? Yes, at the front. Oh, no, sorry, at the back. Sorry.
That's okay. Hi, Minister. This is more a question around the homeless services and all of the contracts. As you're aware, wage CPI has been running at 7%. The Fair Work Award was at 4.6%. Yet our contract CPI increases were at 2.75%. When 80% of underlying costs are wages, and we're thinking about a commissioning process, what's the government's appetite to changing the formula so that the revenue can grow at the same pace as costs that underline how we deliver our services?
Yes, I'm acutely aware of this because I had a meeting with Shelter WA last week who made it resolutely clear that this is one of the key issues.
We had a big flip table and chart and
yes.
points.
So the message has been received loud and clear. Future funding decisions will be considered as part of the commissioning process. So I'm sorry I can't give you a stronger commitment than that. And I understand the message is received. I want to make sure to you, everyone in the room, the advocacy is there. It's for government to consider.
Minister, I just want to pick up on one of your answers because Gray was having discussions with Development WA about something for older LGBTIQ people, particularly lesbians. So I'm just wondering now what you were saying about talking to the Deputy Director General. Are we talking to the wrong people? Should we come across?
So it does, no. So look, it depends on the land is held by many different people. So there's Development WA, which if you remember as part of machinery of government, picked up a lot of Department of Communities land. There is a DPLH, which is the lands agency. There is communities with its housing stock. So it can be a very difficult field. So it might be best to write to myself as the minister, and then we can give advice to you about which land agency. But when I came in as the minister, we created a housing and lands subcommittee of cabinet that does sweep throughs of all land that we know of, but sometimes smaller pieces of land agencies are sitting on. We're actually, you know, I'm throwing everything at this. We're also doing a toolkit for local governments to say, here's all the opportunities, how you could use your land, or you might know of other land for either non-for-profit or for other purposes. So perhaps write and we'll be able to give you advice. Yep. Because Development WA is only one agency for land. Yeah. And you might be missing opportunities.
Hello, I'm Indigenous and I just wanted to inquire and ask, now, when you're a Homes West tenant, okay, back say 20 years ago, they used to have priority listings. So they had priority listings for non-Indigenous and they had priority listings for Indigenous. Now they combined those two lists, and as a result of them combining that, this homeless problem has been created around that. And a lot of other issues as well. But what I've noticed, I forgot what I was going to ask. Yeah, no, I've forgotten what I was going to ask. I will think about it and I'll come back to you.
That's all right. I know it can be nervous speaking. I'm paid to do this job, so don't worry. I give out a lot of speeches, so don't panic about that. I'm not aware. Look, I will be frank. I think whatever lists there are in the system, I think that there have been really other big issues that have contributed to homelessness. And I think obviously you would know, 4 or 5 years ago, the rental market was pretty awesome. If you were a renter, it was rock on. You know what I mean? It was a cheap rental market. Suddenly, through a range of issues, COVID pandemic, increased demand, we now have a really difficult market for renters. And that obviously, I think, is a big factor to contributing, is that when the rental market gets like that. The other thing is, I would say, is just from my observations, and I know the one thing I want to say, I'm not an expert. There are so many people here who are experts on homelessness, and I'm not. But the observation when I look at the city and as the member for Perth is that, yes, we do have a number of homeless rough sleepers who are Indigenous, but I do think that it is this people coming down from country and just getting lost. And then they end up in cycles, you know, and we see terrible cycles of domestic violence at Wellington Square. And so I really want to make that a key focus, is how do we make sure that people don't get lost? If they're coming down for healthcare, that they don't get lost, or if it's cultural or family reasons. And I do want to give a shout out to this, but I was at Bulu Biddy Maya today, and I don't know if you've popped in there to see how it works, but that is our first Aboriginal controlled run homelessness accommodation. 70% of the people there are Aboriginal people, and they've all been long-term, most of them long-term rough sleepers, and they've been referred to by the Heart team, and they've been doing an outstanding job. And speaking to some of those people today, it does give me hope, but it is very clear that there is this cohort of Aboriginal people that are being, so to speak, trapped in the city, and I really want to work on that.
Thanks. Is there another question from the... Oh, sorry. What? Last question. Sarah's telling me last question. I had a question. Can I get a question? I'll talk to you after. Last question.
Thank you, Minister Carey. My name's Elise Jorgensen and I work for Mission Australia, and you might be aware that we run a youth survey every year. Last week we released a section of that survey, and the statistics are quite alarming in the sense that in 2017 it was 1 in 25 young people that were experiencing first-time homelessness. Now it's 1 in 20. I guess my question to you is then around what strategies we have around youth homelessness. I've worked in the sector for coming up to about 30 years, and I know that this government has committed to Youth Futures for another crisis accommodation, which I very much welcome. But what we do know is there's a bottleneck. So there's the youth crisis, where young people often cycle through multiple crisis accommodation. There's very limited transition accommodation, where there is the wraparound support, where it's very poorly funded, often funded by the actual community organisations themselves. And then there's very little other options. So I guess I'm just asking, what is the government's focus on youth homelessness?
Well, I would come back to, look, and thank you for sharing that. I would come back that for me, ultimately, it is trying as part of the housing first approach, whether it's for particular cohorts, whether it's Indigenous or whether it is young people, that we need to, and this has been part of the, we need to create more housing specifically for the Housing First program, and then for streams coming through like youth and Indigenous. Now, that is easier said than done, I'll be frank, because I'm trying to get as much social housing as I can. And then on top of that, I need additional housing specifically for youth or Indigenous and other rough sleepers that are coming through the system. And I'll give you an example where we had one small success. Up in Geraldton, we had 8 vacant units that were part of the public housing stock. We were able to connect it with health and drug alcohol service, and then refurbished them pretty quickly and used it for 8 rough sleepers. So we found some stock, dedicated it, so people not taken from the priority housing waiting list, but people from a rough sleeping cohort as part of a Housing First program. So what I envision, and this is where I want to refocus on Housing First, is yes, we're doing the common grounds, these big, you know, the bigger developments, but I also would like to see, in effect, small Housing First complexes. It might only be 6, it might only be 8, where there are a provider, and it might be targeted at youth, where we can effectively run mini Housing First across Perth. I think that is an achievable aim on top of the 2 big common grounds.
Thanks very much. That is unfortunately all we have time for. If we could just thank the Minister incredibly for his passion and commitment to the... Thank you. I'm going to have to chase you with the gift bag, but we've got like a goodies bag for you, so I'll give that to you in a sec. Look, that concludes the session for today. I appreciate you all sticking around and making the time in such un-Perth-like weather. Perth people aren't good at this, but you've done exceptionally well in risking getting slightly wet to get here. Thank you. Thanks again to the Minister. Thanks so much to the shelter team, growing every hour that I'm involved in shelter. There's another person with a name badge that comes up to introduce themselves to me. I'm delighted to be part of this organisation. I think shelter is a fantastic, fantastic advocacy group, and we do get the flip boards out and talk to ministers very directly when we need to. I just want to give a final shout out to Michelle, who is leaving. We're going to give shout outs for, it's going to be a festival of Michelle leading up to the end of the year. Michelle McKenzie, CEO, Dynamo, for holding all this together. Thank you, Michelle. And I think that's my official duties done, Sarah. Yep, thank you. And talk later.